Hi, I'm Brittany Montez, and this is the Orlando Health News Review for February 23rd. Orlando Health has been named the highest-ranking healthcare organization in the state of Florida on the Forbes 2022 America's Best Large Employers list. Here's Orlando Health President and CEO David Strong with a message about our newest Best Place to Work recognition.
Not only are we ranked the highest healthcare employer in the state, but we also received national recognition as one of America's top 20 best places to work for large employers. This is a phenomenal achievement that reflects the dedication of our team members, physicians, and leadership, especially over the last 2 years. It's been extremely difficult. I started in healthcare 30 years ago mopping surgery floors, and the last 2 years have really been the most challenging for a lot of reasons. And the work that you do has great purpose, and it contributes not only to what you do for patients and families, but also across Orlando Health in making this a great place to receive care as well as a great place to work. Being named one of Forbes' prestigious best employers is an outstanding accomplishment that you have achieved. Thank you so much for the work that you do.
And the Lake Mary Fire Department, in collaboration with Orlando Health and the Lake Mary Police Department, hosted the 5th annual Run with a Hero 3K. All proceeds from this family-friendly event with local military, first responder, and medical heroes will benefit the Camaraderie Foundation, which provides healing for the invisible wounds of war through counseling, emotional and spiritual support for all branches of veterans, service members, and their families. And we talked again with Dr. Lori Boardman from our Corporate Diversity Committee to discuss some of our 3 to 5 year goals to address maternal and fetal health outcomes and disparities in our community.
So we're doing a lot of great things around equity and diversity at Winnie Palmer Hospital. We started about a year and a half ago, a couple months after the pandemic actually started, to do something called a Postpartum Hypertension telehealth or virtual visit program. Through the platform, we developed 2 20-minute visits that would occur in the first week after the mom is discharged from the hospital. Make sure they all go home with blood pressure cuffs, so they're instructed on how to use it, and we want to make sure that we're knowing what their blood pressures are. We answer any questions they have. We can help them with modification of their medications if it's needed, because we develop great relationships with providers, all of whom eventually really endorse this program and continue to this day to want their patients to be involved in it. We understand that we need to know our patients at basic fundamental levels. And one of the things we're completely committed to is making sure that all of us, from administration down through every person that works within the hospital, is able to address patients of different races, of different ethnicities, different origin. We want to make sure our teams can handle that appropriately, sensitively, and bring that patient and their family in and let people feel like they're heard, that they're respected, and that they're getting the highest quality care.
And a surprise interaction between NFL player Jeff Driscoll and Orlando Health trauma patient Austin took place since Orlando Health was featured along with multiple patient names on Jeff's cleats.
Austin, what's up, man? How you doing? I'm the guy. No, you're the guy. You're the guy with your name on the cleats.
You're the guy that wears the cleats.
I wore these cleats. These are yours now.
Jeff Driscoll.
How are you, man?
The cleats were part of the NFL's My Cause, My Cleats, where players had the opportunity to choose a cause important to them and represent their chosen organization on custom-designed cleats. Well, that's it for today's edition of the Orlando Health News Review. We'll see you next week.